Hi, I'm Jonah Essers, and I'm thrilled to be collaborating with the FPIES Foundation to bringing you a series of conversations on important topics in FPIES. And today we're going to talk about allergy testing and whether it can be helpful in diagnosing or managing FPIES. It's probably the most common question I get in my office when families come in with a child that they think is reacting to foods. They want to know what foods their child is reacting to, and they want to know if allergy testing can be helpful. And if I was a parent with a child with food allergies, I would feel exactly the same way. If there's information out there that we can get that's non invasive, shouldn't we get it and see what it shows us? Unfortunately, with FPIES, it's not that simple. So, what I'd like to do is to walk you through what allergy testing is out there, how it works, and let's see how we can apply it to FPIES. So the first test is skin prick testing. This is a procedure where we take a purified protein to a specific food, so think peanut protein or cow milk protein, and we prick it right under the first few layers of the skin. If the skin gets a bump that's red, and if that redness spreads beyond the bump, that's generally felt to be a positive test result. So if you see an allergist and that you have a skin prick test that's positive, you likely have an allergy to that food. The problem is that skin prick testing specifically is looking for what we refer to as an IgE mediated food allergy. IgE is an antibody in your immune system. IgE antibodies recognize a specific three-dimensional shape and try to attach to it so it can cause an immune reaction. So if you have IgE antibody to peanut protein, that IgE antibody will recognize that protein if it's ingested and brought into the body. Then the body will have an overreaction to that protein. And so, where skin prick testing is really valuable is in ruling in or in ruling out anaphylaxis, which is life threatening allergic response. It can cause shock and potentially death. And when you have a skin prick test that's positive, an allergist will consult you whether you're at risk for anaphylaxis. So that's potentially very valuable. One of the pitfalls to skin prick testing is that you can get a positive test result that's underwhelming. It can be a low grade positive, and the question is whether that's a real positive or a false positive. And so again, it really requires a conversation with someone with expertise in diagnosing food allergies. Additionally, it's really helpful if you have a clear story. So, for example, if your child has reacted to a food and you can narrow that food down to potentially a handful, it's better to do a few skin prick tests than to do a lot of them. The more tests you do, the more likely you are to uncover a false positive. So it can be very confusing for families. In summary, make sure that you're having this conversation with someone with expertise in food allergies, generally a board certified allergist. So, after skin prick testing, let's talk about blood tests for IgE. Again, IgE is the antibody that is responsible for classic food allergies. You can do a blood test that gives you a quantitative result, so a number from 0 up to a very high number. And if you test, for example, for IgE to peanut protein, if you have a very high test result, it's likely that you have a true allergy to peanuts and potentially a life threatening one. One of the pitfalls with a blood test for IgE is that it's much harder to interpret a positive result that's on the low end of that positive. And again, that's why it requires someone with expertise in diagnosing food allergies to interpret these blood tests. So the blood tests are particularly confusing for families, and there's often a lot of unnecessary food eliminations because families see these low-level positives and think that they're all true. So you want to make sure that you're being counseled by someone who can give you advice both on the test result and then what to do about the foods. Sometimes that's working with an allergist, and sometimes that's working with a pediatric gastroenterologist, or potentially both. Lastly, blood tests for IgE are quite expensive, so you want to make sure that you're weighing the risks and the pitfalls of these tests before proceeding. Let's talk a little bit about non-IgE based testing. Unfortunately, there aren't many tests for non-IgE allergies. Certainly, the ones that are out there have not yet been proven to be extremely helpful for the masses. Patch testing is one of those areas of interest. Patch testing is where you take a patch of food proteins and you place it onto the skin and you leave it there for several days. This is trying to uncover reactions that might be more delayed, so not ones that are anaphylactic, life-threatening within minutes of an exposure, but something that might develop through continued exposure. And patch testing is still felt to be experimental by many. However, there are practitioners out there that are using patch testing in their community, and I encourage you to have a conversation with them if you want to proceed. However, again, to remember that patch testing has not been shown to be helpful yet for the majority of individuals. The most helpful thing in terms of testing for non-IgE is actually food elimination. So it's not a laboratory test, but it is still a test nonetheless. You can potentially remove foods and see if your child improves. If so, it might be that your child has a non-IgE allergy to that food. So for example, if you have a child with rashes and with mucus and blood in the stool and you remove cow milk protein and over 2 to 3 months you see complete resolution in symptoms, and then you reintroduce that cow milk protein and the rash and the blood and mucus in the stool returns, that is a very clear way of showing that your child has an allergy to that cow milk protein. It's just likely not an IgE mediated allergy. So again, that requires a lot of work and a lot of attention to detail, and I encourage you to do that in conjunction with a health professional like a pediatric gastroenterologist and pediatric allergist, or potentially your primary care physician. Lastly, I'd like to make a comment on the IgG-based blood tests for food sensitivities. These are often ordered by naturopaths. However, they're available to be ordered by all practitioners. And these are testing for the IgG antibody response to foods. IgG is a different type of antibody with no clear-cut relationship to allergy. I usually advise against ordering these tests, and I have never found them helpful in diagnosing or in managing patients with FPIES or for any other food allergy condition for that nature. However, this is a debatable topic, and I encourage you to have that conversation with other professionals that you trust. So when do I send my patients to an allergist? So if I have an inkling that there is an IgE-mediated reaction in there, or I'd like to really rule out an IgE-mediated reaction, I will send my patients to an allergist. So for example, if I hear hives, which is usually bumps or welts on the skin that come within minutes of an exposure, they're usually very itchy and that can have flares of redness in them. If I hear hives, I will send families for allergy testing to rule out an IgE-mediated reaction to the food or a group of foods if it's unclear what food did that. Additionally, reactions that happen within minutes of an exposure often can be IgE mediated. So for example, abdominal pain, vomiting, and rashes, if that's happening within minutes of an exposure, even if they don't sound or feel or look like classic IgE reactions, I will still send families for rule outs. And then lastly, uncontrolled eczema. Eczema is a itchy, red, scaly rash, often in the flexor, in the bendy surfaces of the joints, as well as on the trunk and on the face. Eczema is mixed IgE and non-IgE mediated allergy. So if I've removed foods from a child and I can't seem to get the eczema under control, then I might send family for allergy testing to see if there is an IgE component. If there's another food that needs to be removed, perhaps an allergist can find it. So in summary, there are allergy tests out there. However, most allergy tests that are available for the masses are looking for IgE-mediated reactions. FPIES is not an IgE-mediated reaction, so it's not strictly required for most patients with FPIES. Children with FPIES are at higher risk for IgE-mediated reactions, so I do have a lower threshold to send a child that has features of IgE, and I will send them for allergy testing. And then lastly, the tried and true method for testing a child with FPIES for foods is actually through food elimination and reintroduction. This is a long-term struggle for a lot of families, and I encourage you to find a professional that you trust, who has seen a lot of children with FPIES, to guide you through that journey. Thanks so much for watching.